Good evening and welcome in. First at 6 o'clock here, as the coronavirus spreads, so does the fear of the unknown.
As the CDC predicts, the virus will eventually have a larger impact on the U.S. We are working to prepare you for that possibility.
We want to take the fear away and show you what's really happening and how to protect yourself.
We have team coverage tonight. Megan Sanctorum and Stephanie Wade are working to get answers to your questions. We begin with Megan, who is live downtown. Megan, you just spoke with state health leaders. What are they saying?
Well, they say at this point there have been no confirmed cases of the coronavirus here in Indiana. They said there's really no way to know if or when we will see it here in the state, though, so they have a plan in place and they're getting ready. It's a new strain that hasn't been seen before. Health officials calling it COVID-19. First identified in China, this virus has now made its way to the U.S. But state leaders say there's no need for the public to panic.
That's the one thing that I want to do above all else today is to help alleviate some of the anxiety and the fear associated with this.
Health leaders say this has not yet been declared a pandemic, rather a public health situation. They tell us they are in constant communication with the CDC, local health departments, and hospitals. And they say they're ready if the virus is found in Indiana.
I feel very confident. I mean, Indiana has already, and Pam was here during this time, handled the pandemic virus of H1N1 in 2009. We have been through the Ebola concerns. We have been through MERS and actually had a case in northern Indiana. We are very well supported for this.
Right now, they tell us 26 people in this state are being monitored for the virus. That's due to their travel history or contact with someone who has traveled to an impacted country.
And they are all being basically self-quarantining in their homes in different counties. And our county local health departments are engaged actively on talking to them on a daily basis, asking them if they've developed fever, cough, shortness of breath, any signs or symptoms.
And as of now, none of those 26 are sick. She said most cases of the coronavirus are mild, but it does have a mortality rate of 1%, which is higher than the flu. The elderly population and those with underlying health issues are most at risk. And as far as protecting yourself from this virus, health leaders say the best thing you can do is just practice good hygiene.
Our Megan Sanctorum. Megan, what are they saying for people who have upcoming travel plans, people who might be booking flights? Is there anything they need to know tonight?
Well, state health leaders say at this point there's no need to cancel or reschedule your plans. They say you should proceed as normal, but of course, if that changes, we will let you know.
Our Megan Sanctorum following the latest developments with the coronavirus as it relates here to central Indiana. Thank you.